Namaste everyone. My name is Dr. Salil Vijay Patkar. I am a cancer specialist at Apollo Hospitals. And today we are going to discuss about immunotherapy and its role in cancer. It's a question I am commonly asked and I think it's something that deserves to be explained. It's very interesting. It's a groundbreaking option for treatment in cancer patients now. So just in brief, what is the history? How did we reach here? So there was a surgeon in the 1900s called William Coley. And he had a lot of patients of a certain type of tumor known as sarcoma. And he had a young girl who ended up with a sarcoma of the hand. And they had tried, back then the treatment options were even more limited. So they tried surgery and it came back very fast. And that left him worried that is there anything else we can do for this girl, because he really wanted to save a 21-year-old girl who had a sarcoma. And so one of the things that they tried, he found another patient during that same time who had an even worse stage in terms of the cancer. The stage was even worse. And people had given up all hopes for that patient. But 6 months later, that patient came back to William Coley and he found miraculously that his tumor had almost shrunk by more than 90%. So he wondered that, this person had an even worse prognosis than this young girl, and yet his tumor had almost completely vanished. So he asked him how. And he said, I had no idea. But while taking the patient's history, he found out that the patient had a very serious infection post-surgery. See, back in the 1900s, people were not so aware of all the sterile precautions that needed to be taken while conducting a surgery. But as it happens, that infection that he had, in fact, and the bacteria that set into his bloodstream because of that infection, developed or evoked an immune response. And that immune response, in fact, shrunk the tumor. So William Coley then actually took inoculums of bacteria that he had cultured, and he started injecting it into patients of sarcomas whom he knew would otherwise not survive. And some of them did respond. Of course, that was a very crude method. I don't think if William Coley tried doing those trials today, he would have probably end up in jail. It was very unethical. But back then, it was the breakthrough that was required, and that is the birth of immunotherapy. We have, of course, reached a very, very far way from that now. So I'll try and explain in as simple words as I can what it is that immunotherapy does in cancer. First and foremost, what is immunity? So immunity is this extremely complex, highly adaptable, very ever-evolving mechanism by which our body fights against diseases. Okay, whether it is virus, whether it is bacteria, whether it is a cancer cell. And in most cases, the immunity manages to evade, the immunity manages to destroy the cancerous cell or the bacteria or the virus. How does this do that? Your immunity consists of a very important component which is known as white blood cells. As I think, probably even if you remember your 10th and 11th standard science, you'll remember that. So your blood has white blood cells, red blood cells and platelets. The white blood cells play a very important role in immunity. They further get divided into B cells and T cells. Your B cells are responsible for forming antibodies. These antibodies go and attack the virus, the bacteria, etc. and destroy them. The T cells, on the other hand, are again further divided into helper T cells, which are known as CD4, and cytotoxic T cells, which are known as CD8 T cells. Now, the T cells are directly responsible for killing that pathogen or that virus or that bacteria or the cancer cell. In fact, it is the CD8 cell which directly goes and kills these cells. This is why the CD8 T cell is also known as cytotoxic T cell, or it is also known as a killer cell. It is known as the killer T cell. Alright. So the basic mechanism by which the cytotoxic T cell or the CD8 T cell kills the bacteria or the virus or the cancer cell is as follows. The T cell, the cytotoxic T cell, the CD8 T cell within its body contains certain enzymes known as perforin. This is just one of the many enzymes that it has. Now, when the cytotoxic T cell or the CD8 cell comes in contact with a virus or a bacteria or a cancer cell by its antigen, the antigen is the most important part of that virus or the bacteria or the cancer cell. When it comes in contact with that, it releases this perforin enzyme from its CD8 cell, from the T cell. The T cell releases this perforin enzyme, and as the name suggests, the perforin enzyme goes and it perforates the cancer cell, or it perforates the virus, or it perforates the bacteria, and that's how the bacteria or the tumor or the cancer cell gets killed. Okay, that is the basic mechanism by which a T cell has. Of course, I have simplified it, but that is the basic mechanism by which immunity is propagated by the T cell. Now, this immune response, so if we have an immune response, why is it that we still end up with infections or cancers? Well, the immune response needs to be kept in check. All right, you can't have the immune response working continuously. It can't be in a hyperdrive state, because if that's the case, then you will end up with certain diseases because your immunity is hyperactive. These are known collectively as autoimmune disorders. This includes connective tissue disorders such as SLE, RA, autoimmune thyroiditis, etc., etc. Now, on the other hand, if your immunity is completely shut off, you get immunocompromised. The best example of that is a patient with HIV. An HIV patient has T cells which are not working properly. Okay, this is why an HIV patient ultimately ends up with AIDS. This is why an HIV patient ultimately ends up with a host of other infections and even a lot of cancers such as anal cancers, cervical cancers, lymphomas, which tend to occur with a much higher rate in HIV patients because their immunity is suppressed. So either way, if the immunity is not kept in control, if it's in hyperdrive, you end up with autoimmune diseases, and if it is not working properly or up to its mark, you are going to end up with immunocompromised status and again end up with a lot of infections and cancers. Now, how do you keep the immune cell or the T cell in check? Well, simply put, the T cell has an on and off switch. All right, that on and off switch is known as CD28. It's just a name. The CD28 is an on and off switch which either tells the T cell to activate or deactivate, depending on which it will kill the virus, the bacteria, or the cancer cell. And there are certain receptors that put the switch in off position, and certain receptors or certain molecules that put it in the on position. I have a brief diagram to explain this. So this is your CD28 cell. This is the CD8 cell. This is CD28, which is the on and off switch. Okay. Now there are certain molecules such as PD1 and CTLA4. This activate the on-off switch. So when these are activated, they go and put the T cell in the off switch. On the other hand, you have certain on switches such as GITR, which is going to send an on signal to the CD28 molecule, which in turn will then activate the T cell. So briefly, PD1 and CTLA4 put the T cell in the off position. They inactivate the immune system. And GITR and other such molecules, they activate the T cell depending upon whether there is a pathogen, a virus, a bacteria, or a cancer cell that needs to be destroyed. So simply put, what would I do if I wanted to evade the immune system as a cancer cell? Simple. If I am a cancer cell and I need to evade the immune system, I would make friends with those signals that are going to put the T cell into an inactive or an off state, right? So simply put, what a cancer cell does, again I have a diagram to explain this. The cancer cell has on its surface a molecule or a receptor known as PDL1. The PDL1 goes and binds to the PD1 on the T cell. So what it does basically is that the cancer cell has a receptor which goes and binds to the off switch on the T cell, and so the off switch is then turned on, and the off switch then goes and inactivates the T cell. So the cancer cell has PDL1 on its surface, which goes and binds to the PD1 on the T cell, which is an inhibitory signal for the T cell, and so the T cell then is switched off. So that's the basic, very simplified mechanism by which a cancer cell has developed a system by which it manages to evade the immune system. Right? The cancer system uses certain molecules which help put the T cell in the off position. Alright? So now how do we fight that? Quite simply, if we are to stop the T cell from being inactivated by the cancer cell, we should stop the PDL1 on the cancer cell meeting with the PD1 on the T cell. Right? If we can stop the two of them from binding against one another, we can stop the T cell from being inactivated. That's as simple as immunotherapy can get. How do we do that? We develop certain antibodies in our laboratories. We develop certain antibodies which bind to PD1 on the T cell or bind to PDL1 on the cancer cell, and they prevent the PD1 and the PDL1 from binding against each other. The antibodies that would be developed against PD1 on the T cell go and bind to it, but they do not inactivate it. So it just goes and occupies that space. So that space, since it's occupied, the PDL1 on the cancer cell cannot go and attach to it anymore. That's the basic mechanism of immunotherapy, especially checkpoint inhibitors, which is one of the most important components of treating most malignancies, solid malignancies, by immunotherapy. Alright, now certain molecules that we know of. So we have antibodies which we have developed in the laboratory. These are now available. They are used commonly by us at Apollo. So we have antibodies which target PD-1. These are known as nivolumab and pembrolizumab. Okay, they target the PD-1 on the T cell and they prevent the PD-L1 from binding with it because they have occupied that space. Similarly, we have antibodies against PD-L1 which are known as atezolizumab and durvalumab, which bind to the PD-L1 on the tumor cell and then they prevent them from binding with the T cell. This is the basic mechanism by which immunotherapy works. Coming to how it helps, you need to understand something about chemo. Chemotherapy works, but chemotherapy is quite toxic because unlike immunotherapy, chemotherapy does not target any particular cell. Chemotherapy not only targets the cancer cell, but it also targets every other cell in your body. That's the reason why you end up with hair loss, you end up with diarrhea, you end up with fall in counts, you end up with fevers at times because of chemotherapy, because it is not specific. It's a blanket therapy. Immunotherapy particularly acts only on the cells which are related with cancer and the cells which are related with protecting you from cancer. Immunotherapy does not act on all cells in the body. More importantly, immunotherapy does not have any cytotoxic effects, meaning it does not kill the cell. It rather activates the immune system and tells your immune system that you need to fight against this particular pathogen, whether it is cancer, and destroy it, which is a normal mechanism by which the body fights any infection or any cancer or any disease. So it has a very limited toxicity profile. It has very few adverse effects. I have patients in their 80s and well into their 90s who are tolerating immunotherapy. Okay, and then there is the success story of immunotherapy. Immunotherapy is used in lung cancers. It is used in melanomas. It is used in renal cancers. It is used in cervical cancers. It is used in brain tumors. Immunotherapy is being used in more and more cancers, and there is a really expanding role for immunotherapy now. In fact, recently, up and until now, there was a type of breast cancer known as triple negative breast cancer, which had a much worse prognosis than other types of cancers of the breast. And now we have evidence, and based on the IMPassion trial, where we have started using immunotherapy even in triple negative breast cancers, in TNBC breast cancers, which are one of the worst types of breast cancers, which do not usually respond well to chemotherapy and they tend to recur. And now we have evidence that immunotherapy has a role in that also, and we have started using immunotherapy in that setting. In fact, let me give you an example of how, if you find the right patient, how immunotherapy can have a huge impact in terms of treatment. For lung cancers, if you are the right candidate, there was a trial which was known as the Keynote trial. In the Keynote trial, they divided patients into those who were on chemotherapy versus those who were started on immunotherapy in stage 4. And then you try and find what is the median survival, meaning how long did most of the patients survive on an average. Okay. The difference was, at the end, the median survival was on chemotherapy something like 13 months. Okay. As against on immunotherapy, the patients on immunotherapy, the median survival was nearly around 30 to 32 months. That's almost 3 times higher. And majority of the patients were still alive. So that's the difference between chemotherapy and immunotherapy. Immunotherapy in the right patient can prolong survival significantly. It has very minimal toxicity. The only main problem I find honestly with immunotherapy is the fact that it's not cheap. It's expensive. At present, there are only 2 companies around the world that make 2-3 of the main drugs which are involved in immunotherapy. But it is a matter of time before the costs start falling. It is a matter of time before these molecules are not just patented anymore and they're made by more companies around the world. And we will see that happen, just as we have seen with so many other drugs such as trastuzumab and tuximab and other such molecules which were very expensive when they first came out. So I think immunotherapy is the future of cancer treatment, and it has tremendous scope. And I think we have already started leaning in that direction, where more and more of my patients now tend to go towards immunotherapy. Thank you so much. If you have any questions, please do get in touch with me. I'll help you as best as I can. Namaskar.